Okay. Okay. As I've already mentioned, I want to thank you all for joining us today on this both interesting and important topic. I'm Dave Myers. I'm the director of the Berks Alliance, and we've been hosting these sorts of community forums for a number of years. I'm going to quickly introduce John Weidenhammer, who's the chair of the Berks Alliance Investors Board, for some comments. John?
Hi, Dave. Good afternoon, everybody, or good morning still. Thanks, everybody, for joining the call. As you know, this is a series of conversations that we have on a monthly basis. I want to start by thanking Dave Myers for his great work in organizing all this. And I especially want to thank all of our presenters who I think are going to provide keen insight into the role of anchor institutions in our community. Some of you may know that really the origins of the Berks Alliance really were started by the Reading Hospital and the Reading Health System back in 2014-15 time period, where we were really looking at the role of anchor institutions and how they could interact with each other and collaborate in our community. So really, this topic has its origins way back at the beginning of the Berks Alliance. And as you know, the Berks Alliance really is a collaboration of anchor institutions in our community, focused especially on community development. So again, thanks to our panelists. Thanks to everybody for participating. Dave, I'm going to turn it back to you.
Thank you, John. I'm going to quickly cover some ground rules and how the event will proceed. We ask you to mute your microphone while you're in the meeting so that we don't have a lot of background noise, but to leave your cameras on because it's always good to see living people. We asked you to use the chat function at the bottom of the screen here to submit questions and comments. We will get to those after we get through our program. We're going to do a slightly different program today. We're going to have our presenter from the Federal Reserve Bank, and then we're going to have two local leaders of anchor institutions respond or engage in a conversation with her about that. As I mentioned, we will send you a copy of everybody who registered for the event, a copy of the video of this program. Deborah's agreed that we can send you copies of her PowerPoint and the link to the website she's going to show us in a few minutes. We also will post the video on the Berks Alliance website, and we share it with the local community media, BCTV, so they will put it on their website as well. So we're going to get a lot of attention for this very important issue. So with that, I'm going to start. I'm going to introduce our major presenter, Deborah Diamond. Deborah is the director of the Anchor Economy Initiative at the Federal Reserve Bank in Philadelphia. And she's going to share information about this initiative and the impact of anchor institution in Berks County and beyond. With her colleagues at the Federal Reserve, she's created the Anchor Economy Dashboard. Before joining the Federal Reserve in Philadelphia, she led Campus Philly, which created a national model for engaging and retaining recent graduates in the community where they studied. And she also was involved in building a 50-city learning network focused on strategies for talent cultivation and retention. She's a graduate of Bryn Mawr. It's important as we're talking about anchor institutions to raise all that, and holds a PhD from the University of Chicago. And joining Deborah on our discussion will be Jackie Fetro. And Jackie is the president of Albright College, position that she's held since 2017. Before coming to Albright, she held leadership positions at several colleges and universities. She was also the co-founder of a biotechnology software company, so she's had several careers in different areas. She's brought the internationally recognized Total Experience Learning Program to Albright, which is having a dramatic impact on basic education, not just in our area, but across the state, the country, and even internationally. Albright is also in the process of creating its own innovation corridor designed to stimulate economic development in the Northeast region of Reading. Jackie is, as she mentioned earlier, to those of us who are on early, a graduate of Albright, so it's interesting she came back home, and has a PhD from Penn State. But the most important thing about Jackie is she's also a graduate of Camp Hill High School, which happens to be my alma mater, although I was a little before Jackie. So Jackie is going to be one of our responders and engage with Deborah in a conversation. And then I'm pleased to introduce a good friend from a long time ago, back in the Rendell administration, Sue Parati, who will introduce our other responder. Sue, you're going to have to unmute.
Well, good morning and thank you, Dave. I'm here really to support Chuck Barbera, who is the CEO of the Reading Hospital, and we'll be talking about the importance of Reading Hospital as an anchor institution, but also I refer to us as a legacy institution, having been an anchor in this community for 150 years.
So, Deborah, we'll get started with you.
Thanks so much. Thanks, Dave. Thanks to the Berks Alliance for inviting me. I'm going to share my screen. And Dave, I'll look to you as a thumbs up that you can see the screen. Yep. Terrific. Thanks. All right, great. Well, I am pleased to be here. I have to start my presentation with the traditional Fed disclaimer that the views I express are my own and not those of the Federal Reserve Bank of Philadelphia or the Federal Reserve System. So with that out of the way, we can get started. Just wanna, it's for some reason, it's not, there we go. Okay. So what I'd like to do today is first explain why the Federal Reserve Bank is interested in the anchor economy in the first place, not necessarily a natural connection between the Federal Reserve Bank and universities and hospitals. So I'll explain what our interest in these sectors are. I'm going to describe the anchor economy dashboard, the data set that we've created around anchor institutions, and give you a brief demo of how it works and hopefully encourage you to explore it further. And I have some specific data around Reading and Berks to share with you as well that I've drawn from the dashboard. And then most importantly, and I think most excitingly, the conversation with Jackie and Chuck around the role of anchor institutions in Reading specifically. So looking forward to all of this. So first, to why the Fed's interested in anchor institutions. When we talk about anchor institutions, we're talking about hospitals and universities. There are certainly conversations around anchors that include large nonprofits, philanthropy, sometimes private sector employers that are committed to place. But for our purposes, we're focused on hospitals and universities for a few reasons. One, these are often the largest employers in a region, and they are anchored to place. They don't pick up and move like corporate headquarters might. Sue referenced the legacy institution that is Reading Hospital. They stay in place over decades. And so that plus their large role as employers, and their commitment to place as mission-driven organizations often really explain why they have a significant and distinctive role in communities. We know they have significant economic impact. They're often identified as the largest employers. Many institutions do individual economic impact analyses and studies, but we really lacked a fact base for what, as a collective, their economic impact was in a region. And so the Fed wanted to understand, if you look at these sectors together, what does it mean to a community in terms of economic activity? And there really wasn't an answer to that until we created the anchor economy dashboard. And with that information, and this is, I think, the value of the conversation we're going to have after, with that information, communities can have a conversation around the role of their anchors in economic activity and employment, and other critical aspects of community and economic development. So in creating the data set that I'm going to share with you today, we had two questions. The first question was, What's the impact of these institutions? What does it mean in terms of employment and income and general economic activity? And then a separate question is, how dependent is our community on these institutions for economic activity? So as I'll share in the data later, you can imagine a place where there's a lot of economic activity around hospitals and universities, but because of other things that are going on in the economy, a region isn't completely dependent on those institutions. Whereas we can think of college towns or some other places where there's a major hospital where we know that the community is not only relying on these institutions for jobs, but they really are dependent on these institutions in the economy as a whole. And so I'll share the distinction between economic impact and economic dependence as we go ahead. So just to describe what we've done in creating the Anchor Economy Dashboard, though the work is initiated out of the Federal Reserve Bank of Philadelphia, we've created a data set that is national in scope. So we include 524 multi-county regions that comprise the entire United States, both metro regions and non-metro regions. Because we wanted to create a national data set, we didn't rely on the reporting of individual institutions to the Philadelphia Fed, but we relied on their reporting to the Bureau of Labor Statistics on publicly available data sets that identify employment and income from hospitals and universities. And we used an economic impact analysis tool called IMPLAN, and I'll describe very briefly what economic analysis does. We used an IMPLAN to derive the outputs that I'm going to be sharing with you. We've combined hospitals and higher education institutions together when we talk about impact. So we have impacts as a sort of collective of those two sectors together. So just very briefly, what economic impact analysis does is, we know the institutions that we're talking about employ a lot of people, but their impact doesn't stop there. So economic impact sort of tracks the flow of dollars from institutions throughout an entire regional economy. And you think about all of the jobs and goods and services that are supported by higher eds and hospitals in a regional economy, and that's what economic impact captures. So there are indirect impacts from, say, the goods and services that a hospital or university will purchase locally, whether it's using accounting services or buying supplies for their institutions from local suppliers. Those companies, those businesses are supporting jobs because they have hospitals and universities as clients and customers. So those are indirect impacts. And then induced impacts, you think of the employees at these institutions and employees at the businesses that have hospitals and universities as their clients. All of those folks are spending money in a regional economy. They could be buying, it could be a coffee shop next to campus or a dry cleaner near the hospital. They all rely on the economic activity that is generated by the hospitals and universities. So this is the total impact is what we're talking about today, both direct, indirect, and induced. And this is another reason the Fed is so interested in this. When you look at the total impacts of hospitals and universities on economic life in the United States, it's huge. So 9% of jobs are associated with higher eds or hospitals in the United States, either directly or indirectly. And it comes to 1.1 trillion in income annually and 1.7 trillion in GDP and gross value added in economic activity in the country. So huge impacts nationally. Another reason to want to create this this data set and fact base around what it looks like across the country by region. So as I said, in addition to wanting to understand the economic impacts of higher eds and hospitals, we wanted to understand in a particular community, how dependent was a region on hospitals and universities? How much of the regional economic pie do hospitals and universities take up? And this is what the Reliance Index that we've created tells you. So, when you look at the proportion of jobs or income or gross value added in a community that's a proportion that is related to hospitals and higher ed, and you compare that to the country as a whole, we can say that a particular region either over-indexes on eds and meds for economic activity or under indexes on eds and meds for economic activity. And again, the over or the under is compared to the United States as a whole. And so just going to give some examples of what this looks like. Here. So in this graphic, you can see that the United States is 1 on the Reliance Index scale, right? Totally average when it comes to the proportion of jobs and income and gross value added relative to higher eds and hospitals. And here what I've done is I've taken regions by population category and mapped what their Reliance Index is. So Cleveland, Ohio, for regions over 2 million in population. Cleveland, Ohio is actually the most reliant on eds and meds at 1.7. And you can see Ithaca, New York, you can imagine what Ithaca, New York would be like without Cornell, without Ithaca College, right? You can see what a large proportion of the economy eds and meds are in Ithaca, New York, which is a relatively small region. And then you see some college towns in there as well, Durham, Ann Arbor. We'll take a deeper dive into the Reliance Index, but this just gives you a sense of what the Reliance Index is measuring in regions, the concentration of higher ed and hospital jobs, income, and economic activity relative to other things going on in that regional economy. So as I said earlier, these are 2 distinct measures, impact and reliance. And I think that this slide representing the New York metro region and Ithaca, New York, really captures this pretty well. So New York has the highest job impact relative to universities and hospitals. 1.2 million jobs in the New York metro region are dependent on universities and hospitals. It ranks number 1 in job impact. But it's totally average when it comes to the reliance on eds and meds jobs in its economy. Maybe the only way in which New York is totally average. It ranks 224 in the Reliance Index. And that's because there's so much else going on in the New York economy that, an individual institution in higher ed or healthcare in New York might consolidate or even close, and the New York economy would still go on. So, but we look at a place like Ithaca, New York, where only 19,900 jobs, and it ranks 173rd in terms of job impact in the country as a whole. But Ithaca, New York is so dependent on these institutions, right? So it's number 1 in the Reliance Index at 3.71. So just and we'll see this in the context of Berks too, that your peer set changes whether you're looking at impact on jobs and income or you're looking at reliance. So I'm going to very briefly, I think maybe I'll do the demo at the end because I want to present some information specifically about Berks, and then we'll go into the dashboard and you can see how it works, very user-friendly. So specifically, I pulled some information from the Anchor Economy dashboard. I pulled some information from the Anchor Economy dashboard that shows both employment impact and reliance for Reading and some comparable places. These are places that are sort of similar size, similar total employment impacts. And as you can see, similar kind of reliance on eds and meds for economic activity. So I don't know from an economic development point of view whether these cities of Mobile, Youngstown, Boulder, Savannah, Anchorage, and Flint sort of are seen as peer or competitor regions, but when it comes to economic impact from higher eds and hospitals, these are your peers. These are cities and regions that look similar to Reading. Just in contrast, these are some regions with much higher reliance index, but similar number of employment impacts. And as you can see here, these are college towns like Bloomington, Indiana. Rochester, Minnesota is where the Mayo Clinic is. So you see the difference of having probably a national or international anchor institution in a relatively small region and how that affects the same number, it results in the same number of jobs, but very different kinds of dependence on these higher eds and hospitals. And certainly in conversation with some of these places, it means very different things for the kind of infrastructure a place needs if it has an international or national anchor institution in the context of a small region. And just one last slide on the details of anchor institutions in regions. I think this is important to see the relative significance of hospital operating and capital expenditures relative to higher ed operating and capital expenditures when you have both hospitals and universities in a region. So, hospitals are generally larger and more expensive institutions to run. So when you have both, as you can see in this comparable set, really the bulk of the economic impact is hospital related. And I think, as we talk about the role of these two institutions and changes that are happening in either the healthcare sector or the higher ed sector, it's important to understand the relative weights of the two sectors in the context of a regional economy. So with that, I am going to stop sharing and do show you very briefly how the Anchor dashboard works. And then I think most importantly, transition to a conversation with Jackie and Chuck on what this data and what their role as anchors means in the context of Reading. So let me very quickly, now I'll turn to Dave again and for a thumbs up that you can see the Anchor dashboard now. Okay, terrific.
Got it.
All right. So this is the Anchor Economy dashboard. If you go to Philadelphia Fed/Anchor Economy, this is what you'll find. And as I said, a pretty dynamic tool. So I'm just going to type in the region here. And let me just minimize my, and every region in the dashboard has a profile page, which, as you can see, you can download and share. And it displays the economic impacts in terms of employment, income, and gross value added for the region, and what percent, what share this is of overall economic activity. So 9% of employment in the Reading region, which is obviously significant. And then it breaks down those impacts in terms of direct. That's what the hospital and colleges are employing directly. The indirect, those are the goods and services in the local supply chain that the hospitals and universities are using and procuring. And then induced, all of those folks spending money in the economy that's churning through your retail establishments and other services churning through the regional economy that stays local. So you see the total with the direct, indirect, and induced, and then you see what the reliance index for the region is. So as I said, every region has this profile, and then you can compare yourselves with other regions. So I pulled some comparisons earlier, but here we could also add, sorry, I'm going to add it down here. Let's look at some other regions, maybe in the state. I'm going to do Harrisburg. Let's pick Allentown. And I'll do one more. Let's do Scranton. So just taking a look, you say, we want to see what we look like compared to some other regions in the state, and you can select those regions and you see them appear here with their employment, income, gross value added, and reliance. And so, Scranton and Reading, relatively similar. Harrisburg and Allentown, in the Harrisburg region was where the Hershey Medical Center is. Allentown obviously has some larger universities in it, and so you can see how they are in contrast to Reading. And then you can also take a look at metrics by employment, income, reliance index, and just very quickly, this will show you the largest employment impacts, which are, as you can imagine, associated with very, very large regions. But if you wanted to filter, for instance, for just regions that are smaller, between 250,000 and 500,000, then here we start to see the college towns, right? You're looking at smaller regions with very large anchor employment are going to be the homes to major public, usually universities and health systems. So I encourage you to fiddle around with this. It really is, there's just a lot to explore for places that you're interested in including your own. And with that, I will end, and I think we're going to turn now to a moderated conversation where I'll be asking some questions of Chuck and Jackie about their roles as anchors in Reading and what the implications of that are. Okay. So starting if both of you could maybe speak a little bit about what it means to you to be an anchor institution in Reading. I talked about why we're interested in anchors at the Fed, because you persist over time and are so committed to place. And maybe Jackie, I'll start with you and then turn to Chuck about how you live out that anchor mission at Albright College, and ask the same of Chuck after that.
Yeah, thank you, Deborah. Really appreciated your presentation. And I was looking at the anchor dashboard earlier. It's really interesting. You can learn a lot from that. In addition to a lot of what you said, when I think about Albright as an anchor institution here in Northeast Reading, anchor institutions, I also think in building their place as an anchor institution should identify their unique strengths and build on those. And those strengths will be specific to each institution. And I also think that they should identify and grow their own sense of place, grow out from where they are. So when we look at Albright's strengths, we're a very strong and well-recognized national liberal arts college. We are nationally ranked for programs across the liberal arts, including theater and the sciences. 90% of our students who apply to medical school are accepted into medical school. We are also very strong in our collaboration with Total Experience Learning and beginning to be nationally and internationally recognized for our programs in education. In addition to that, we have long been a college that educates the students of the middle and working class, and we are nationally recognized for that. So we're ranked number 14 by US News and World Report. That's number 14 in the entire country in their ranking, US News and World Report ranking for social mobility. And as Deborah said, with the Eds and Meds, we're long living. We have been around since 1856 and in our current location since the 1920s. We also want to look at where we are and build where we are. We are located in the city of Reading, here in Northeast Reading. Up here in the College Heights neighborhood, we have some of the strongest single family homes in the city of Reading, and we want to develop this area. 13th Street is also the only street in the country where you can go from kindergarten to graduate school on the very same street. So we are strong in education from the beginning to the end. As Deborah said, we also look at economic impact, and in an economic impact study developed by Parker Phillips in 2018, Albright College impact, the annual economic impact of Albright College on the local and state economy was 102.4 million, supporting 1,094 jobs. And as Deborah said, we're counting direct, indirect, and induced in that. And the economic impact is also combined with our rich cultural offerings, the Friedman Art Gallery, the Lakin Holocaust and Resource Center, the Black Cultural Collection, and our local history collections. So how have we exemplified taking those as our core tenets and embracing our role as an anchor institution? How do we enact that? In what form does that take? Well, one of the things that we've done since I've been here is we have partnered very strongly with the College Heights neighborhood. We are a member of the College Heights Community Council. We formed 2 task forces, one on our shared future and one on educational attainment. We developed a community needs survey several years ago, collaborating between our students, our faculty, and the residents of this community, and are really looking to meet the needs identified in that community needs survey. The second example is we've partnered with Adele Shade and Total Experience Learning to really build, let's take advantage of the fact that 13th Street is the only place in the country that has this kind of educational opportunity, and to really make that a world-class educational program and community. And so developing that opportunity with Adele and Total Experience Learning has been a focus of ours. And then finally, growing that. Albright has long been a place where our students and our faculty are extremely creative and innovative. And when we brought Total Experience Learning into the picture, that was enhanced even more with students developing patents and intellectual property in ways they had not before. And so we have begun to build this vision for the Innovation Corridor in Northeast Reading, a place where when people come to it, what we're aiming to do is create a sense of place of this is where innovation happens in the city of Reading, that combines Total Experience Learning, it combines Albright College and some of the businesses in our neighborhood. So in terms of how do we, I forget how you raise the question, how do we embrace our role as an anchor institution? That's what we are doing at Albright.
Thank you, Jackie. And I really appreciate the perspective of understanding the institution's strengths, you know, academic, geographic, social, and cultural, and leaning into those and sort of defining the anchor role. Chuck, I wonder if you could share for Reading Hospital the role that being an anchor plays for Reading in defining its relationship to the community and in your community work.
I'm going to ask Sue to jump in first.
Yeah, Deborah, I just want to make a few comments. I've been with Tower Health for 2 years. I know many of you in the community who are on the call. And I needed to say this in the beginning, and then I want to turn it over to Chuck. But the only reason I'm here is because it was clear to me how important this institution is to this Berks County community. And we ran into some very significant financial obstacles, crisis of confidence that we had to address very quickly. I thank everybody who has been so supportive of the hard work we've done to turn around the institution. But I came to just say, the reason I'm here is because the value of these institutions to our communities are little understood and appreciated, but very clear if you lose them. And I did not want that to become a very clear picture for this community. I want to introduce Chuck more fully. Chuck has been the CEO of Reading Hospital for about a year now, but Chuck has deep roots, and he came to the Reading community right after he finished his training and was the leader of Reading Hospital's emergency department. Little known fact that it's the busiest emergency department in the state of Pennsylvania. So surprising to many people, but a very significant piece of how we meet the community. And Chuck is going to talk a little bit more about the work that we actually do in the community that is little known. But what was very different from my perspective in other businesses is that this is a life and death business as well. So much of what we do is to make sure that people have healthy lives, but we make a huge difference in moments of crisis. And I'm very proud to say that the Reading Hospital has been ranked for the last 2 years one of the top 50 hospitals in the country, not just in the region, but in the country. So the significance of the quality of this institution, the investments they've made to make sure that we can get the highest level of healthcare right here in our community and not have to travel to communities that are inconvenient to family members or to the patient themselves. So all of those factors were so critically important in my mind that I came out of retirement to come back in here and make sure that this legacy institution is here for the next 150 years. So Chuck, I'm going to turn it over to you now to talk about how proud we are of the Reading Hospital.
Well, thank you. And I think that the word there, and I know that we also are proud of Jackie. And one of the things when Jackie was saying how proud we are to be in the community with places like Albright that are trendsetters and leaders. And I will thank Jackie as the vice chair of the board at Reading Hospital. So it just goes to show that we know that we are interconnected, that there is no way, there is no Reading Hospital without Albright College or without St. Joe's for that, or Alberti or anyone. I mean, what are all of our missions? And when we go back to the mission of Tower and Reading Hospital, it is to provide high quality healthcare, to promote and maintain wellness and health in the community, to educate healthcare professionals, and to do appropriate research. And so when you look at that mission, it's very similar to Jackie's mission. She talks about, and honestly, in med school, it was a long time ago, more kids in my med school class came from Albright than any other college. And they really had a track record and still do of putting out great doctors. And they come back here and they work for us. And that's a blessing because they love Reading. So when we look at our mission, and much like Albright, you said anchored, and it was funny when you told us about anchored institution, I always thought, I didn't think of anchor being because we don't move, right? I kind of thought because, we're something that people latch on to. Yeah. So it's kind of interesting. We have been like Albright, we've been here, next year will be 100 years on our current location, and 150 plus years we've been as well in existence. We are one of the top employers here, probably number 2 or 3 in this community in the county. What I think is really important, and Sue and Jackie hit on this, is pride. The thing that we do for this community, not any one of us individually, but collectively, is that our employees and our community have pride in Reading, and Reading Hospital is one of those things, one of those pillars that people have pride in. And so we have a clock tower here, and I guess if I were techie, I could put it up somehow, but I can't. But, that people recognize as a symbol of Reading, much like our pagoda and other things, that is Reading Hospital. And when we look at what our mission is, it is the pride that our staff has. Hey, I work at Reading Hospital. Now, why is that? Well, you know why? Because we're sort of insulated. And I think you brought up some things. We're a 0.98 or whatever it is, but we're really isolated by mountains. So once you get into Berks County, it ain't easy to get out, right? So once we're here, we kind of deal with what we got. And there's a lot of pride in that, and making sure that we have everything we need in this community to take care of the community. But our staff aren't people, much like some of the other metro areas, that can get on a train and go home. They walk home, right? Or they bike home, or, or they live on campus. So we've got a lot of, we have a lot of that, in addition to the medical expenses, and you brought up, unfortunately, the cost of healthcare is going up. There's new technology. It is expensive. It does generate a lot. The benefit of that is then the new technologies, we're able to train people. And so basically what Sue and Jackie do is they develop programs with us to say, well, what do you need? What do we need? What do we need? And how are we going to prepare people? And it may be something like teaching them a language, maybe a skill that you can use that's a techie skill. So those things for Reading Hospital are really important. It's important for us to be grounded and know what our community expects of us, keeps us honest, right? Competition is there. But the fact that we generate close to $1 billion a year in total revenue just at this hospital for the community, whether that's induced, indirect, or direct revenue. Some of the things that you might not appreciate are, we have 6,000 employees. They all need a place to live, right? And so when you look at the housing boom, right, and we're starting to partner with Albright actually to say, you've got housing and our students or our residents, they need housing. Maybe we can make this work. We train over 300 residents, graduate medical education. These are people that have earned their doctor degree, but are in residency training. Over 300 of them are at Reading Hospital at any one time. In addition to that, we've got over 100 medical students from Drexel University here. These people all need places to live. And unlike the undergraduate experience where a dorm might be sufficient, these people are older in their lives. They may have families, they may have children, and that creates this wide opportunity. I will also go into the fact that Reading Hospital is in a borough called West Reading, which just abuts the city of Reading, separated by the Schuylkill River. The Reading Hospital is key, and I think there are many people on the call. I certainly saw Karen Reitmeyer, and I'm sure there are others who were really invested in the borough of West Reading and in the revitalization of what was kind of a mill town or a textile town. And when that business left, we had what many small cities are facing, a lot of empty buildings, but no one to live there. So the hospital is investing in that. And finally, I will talk about it, and I hope Deisha Dixon and Courtney Powers are on the line. They are the drivers at Reading Hospital for community benefit. They're the ones that look at our community and say, do a needs assessment. What does the community need? And they advocate for the community needs, keeping us honest to say, you've got these resources, what are you going to use them for? And they use them for many things, like a street medicine program, where our team of our doctors and nurses and pharmacists go out and treat the homeless where they live. They help coordinate a mobile mammography unit. There was a need that mammography, since COVID, many women were not getting their mammograms because there was fear of going out. And so there's this backlog. So they developed a mobile coach that goes out into the community and does mammography for those at risk that need mammograms. They've introduced community health workers, probably one of the things we're most proud of. You know, I'm an ER doc, and the one thing that I learned, and Sue said, we have the busiest ER in the state of Pennsylvania, and one of the top busiest in the country. But I'll tell you a secret, they're not all sick that come there, right? And the reason they come is because they have needs that aren't met anywhere. Some are medical, some are not. And so Deisha and her team have developed the community health worker that really can help people navigate and look at social determinants of health that aren't necessarily medical. Food insecurity, transportation insecurity, financial insecurity, abuse, housing insecurity, those things, and how do we address the whole person to make sure that we maintain wellness? And obviously, a well community is a community then that thrives, that works, that contributes back. And then finally, I would be remiss to say that all of us, Albright, Reading Hospital, St. Joe's, everyone in this community are working hard to combat the mental health problems that we see and the drug epidemics that have come through all towns. And it's a huge need. And this is without these institutions, you know, providing these kind of services to the community for mental health, we would really not be able to progress forward. So thank you.
Thank you, Chuck. I mean, it's tremendous to hear the range of involvement and service to the community. And I think you both mentioned some of the collaborations that occur between your organizations, sitting on each other's boards, obviously, and the synergy between the educational mission and the healthcare mission. One thing that we're hearing from other communities are the anchor collaboratives that have started up, and obviously there's already an anchor collaborative in a sense in Reading and the creation of the Berks Alliance itself. but these other anchor collaboratives in other places have started up to look at, where are we spending our dollars? Like, where are we procuring our goods and services, and how much of it is staying in the local community? Or, what are the workforce challenges of our region? And what are we doing collaboratively around both education and employment around those challenges? So I'm curious if you could identify or speak to some collaborative efforts that not just your own two institutions, but maybe the broader institutions as well, have either accomplished together or are thinking about working on together, and why you picked those things and what you expect to get out of them.
Yeah, so certainly. Deborah, I love that. I love that term, anchor collaboratives, because I think we definitely have that. Not only with the Berks Alliance, we also have the Higher Education Council of Berks County, which is the 5 institutions of higher ed, and we get together. The presidents get together quarterly. So that's a really good phrase to define that. Collaborations are numerous and many. So I'm going to talk about just 3, which touch on different points of collaboration and impacting the area of Reading and Berks, and I'm sure Chuck has many more. I think it's really important in 2 things, that the institutions again identify their distinctive strengths, and then they identify the community needs and then work together to address those. So this one was from a while back, but I think it's a really interesting one. And it was when Chuck was an ER doc, not the CEO of Reading Hospital. And he had his ER, the busiest ER in the country, had a need for scribes, people who would take those medical notes. And as we've already said, Albright College we are a premier program for educating students who go on to be doctors. And this was an ideal opportunity. Reading Hospital approached us of the idea for scribes, but then they said, we don't have much money to pay these kids. And we said, well, that's okay. We have college credit, and that's what's valuable to them. So the Albright students were for many years going into the Reading Hospital, acting as scribes and getting credit. And then we're able to develop these networks and get recommendations and experiences for applying to medical and other pre-health program professional schools. A second one is much more recent, and it is between Albright College and RAC. And I will note that Susan Looney, the president of RAC, is the chair of the Reading board. So this interconnectedness, Reading Hospital board, so this interconnectedness extends far. We were approached by the superintendents of some local schools, and everybody knows we're talking about the teacher education shortage. And they said, can you help us solve this? And they said, this was the problem. They stated it very clearly. We have paraprofessionals in our classrooms who do not have the certification to be teachers. They need to continue to work as paraprofessionals and make money. So we need a way for them to become certified in teaching so they can actually become teachers and progress from being paraprofessionals to being teachers. And so we approached RAC, and we developed this pipeline where students can enter pre-associate's degree. They can get their associate's degree from RAC through their bachelor's degree at Albright, a certification in education, and even on to the master's if they wish. And we've done it in such a way that the students or those who are working, the paraprofessionals, can come on and off this pathway at times depending upon their needs. And by collaborating, we jointly offer credit. So these degrees can be offered more inexpensively and in less time than a standard going to the associates, then going to a bachelor's and then getting your certification. So really responding to the needs of the schools in our community to educate teachers. And then finally, focusing on we also heard, and this was already spoken about, the need for housing. Chuck and Sue already spoke about this, housing for young professionals in Reading, as Drexel has come in, as as Reading Hospital has expanded its residency programs. And Albright College has apartment buildings that formerly housed college students. And we are renovating those to become, and they're actually already now being leased to medical schools, residents, and other young professionals in the community. So we are taking the opportunity to take what is in our infrastructure, where we no longer need it for undergraduate students, and renovate them and turn it into opportunities to meet the needs of our community. And I want to go back, I mentioned the Higher Education Council of Berks County, because it used to be 5, it is now 6. The dean of the Drexel Medical School here in Reading has joined that group. So there are now 6 of us, 6 schools that are part of that council. So the collaborations, I think, are rich and strong and need to continue that way.
Thank you, Jackie. I want to turn it to Chuck to talk. And I think one thing that's striking is that collaboration doesn't just happen automatically, that you have something like a council, a table that's set where these conversations can occur. And I assume the same exists with the school district when they voice the need for teacher training and the upskilling of their paraprofessionals. So might be interesting to have a conversation, discuss that sort of later on, what kind of tables you need to have set in a community for the anchors to be able to do this collaborative work. Chuck, I want to turn it to you and talk to hear a little bit about how anchor collaboratives sort of have advanced your impact in the community.
Well, it's true. And I will say one thing that we are blessed with here, and I think that makes it work so well, is that there aren't a lot of egos leading the anchor institutions in Berks County. And we're blessed with that. I mean, people lead with their hearts and they lead for their community. And that has helped, build bridges where, you know, in other places that might not be. There's no threat. Jackie doesn't say you're going to take my students or whatever, you know, I mean, and we don't do that. We really share every resource we have, because I think every one of us realize if one of those institutions doesn't do well, the city of Reading doesn't do well, and Berks County doesn't do well. So I think putting your ego at the door, or not even having an ego, is very helpful in this environment that we work. We also do, you know, a lot with education. Again, I talked about Dishan, and who was the VP of Community Benefit and Diversity and Equity and Inclusion here, who developed a very, very strong internship program, initially with the City of Reading School District, to take high school students and just expose them to life in a hospital. And, you know, Sue and I like to say, Reading Hospital is a city. It could be a city with, it's like Vatican City. You have everything here. We've got plumbers, we've got IT folk, we have doctors and nurses, right? But we have grounds crew, we have printers, we have pretty much any accountants all out the wazoo. You know, we have pretty much any position that you want. So having the high school students see that, and now Disha has expanded that tremendously. It's open to any high school student in the county. And I saw patients this morning, and I spent the morning with a young woman wants to be a physician. She's a senior at Twin Valley. And what a great experience, you know, to have her in the emergency department and see what it's like and those kind of things. And they rotate all through the hospital, and it's very helpful for them. We also have partnerships. Again, we have a School of Health Sciences at Reading, which is under the Reading Hospital, and it trains nurses, it trains x-ray techs, it trains CAT scan techs, laboratory techs, surgical techs. And what we've seen recently is that there was a need for EMTs. So we brought an EMT program in. We had a paramedic school. And what that has done for us is that there are communities within Berks County for financial reasons, they could not maintain their 911 service. And we have a 911 service here. And we were able to then train our own workers and then put them on ambulances to serve communities that would not have 911 service if it weren't for the Tower Direct is the LLC, or is the corporation in Tower that runs this. But those kind of programs are very helpful. We have about, at any one time, 700 learners really on this campus, and they don't all work for us, right? That's important to know. They go and they work as school nurses in the school district. They work in nursing homes. They work in the colleges and the universities. They are the workers' comp or occupational medicine nurses in our East Penn manufacturing, in many of our companies here. So they aren't all trained to work at Reading Hospital, but they are all trained to promote wellness in our community. So the things we do for that don't necessarily all affect Reading Hospital. The last thing I'll say is one of the partnerships we have that we're most proud of is our partnership with the Caron Foundation. The Caron Foundation is a nationally recognized inpatient and outpatient drug and alcohol treatment center that started in Berks County as kind of a little house that people would take in, and has really grown to be one of the premier and most successful drug and alcohol centers in the United States. And Reading Hospital has partnered with them, and we actually partner on training people, physicians and mental health workers, to help to participate, to get certified in addiction medicine. Again, addiction medicine takes a certain kind of person. Many people are actually in recovery themselves, and help people walk through and navigate the very difficult process of recovery from addiction. And so our partnership with the Caron Foundation has only grown and grown. And we have now in our ED 24/7, we have a recovery specialist because we see people coming in with overdoses 24/7. And we realized here that if we don't have a specialist right there when that person overdoses, we're going to lose that person. The next time they're going to leave, they may not get the shot. They may not be brought in alive. So we've partnered with Caron Foundation and other agencies. And I will say, we also partner with our government agencies. And then one of the things that I thought, Deborah, was interesting is when we look at our relative index here, how does that compare with government agencies? My guess is they're higher employers and they have a higher impact than meds and eds.
Depends, probably.
Yeah, we actually haven't done an analysis for the other significant sectors in each region, but you're right. In a lot of places, government is going to be number 2 or number 1.
So we partner with we know that we're meeting with a government person this afternoon, I think.
Right, we are.
Yeah, really to partner with the government and let the government know what the needs are and how we work together.
We don't talk about it, but we are also the county morgue. We do all the autopsies. Chuck's being a little bit, I think, shy or humble, but he led the effort to start a program in addiction treatment called the Warm Handoff, right? Do I have that right?
Yeah, that's right.
It has been recognized by the state and nationally as one of the best run programs and making the biggest difference in treatment and the recidivism, right? That do they come back? Just an outstanding program. And it's just an example because there's lots of groups that work together in that program. To your point, there's government agencies, there's the welfare departments, the foster programs. There's a lot of involvement of all those different parts. So I think that I just want to give you a little applause for taking the lead on that and making such a difference, because we tend to talk about the big numbers, the busiest, but that happens to be, you save a life one person at a time. And it is some of the hardest work, and it's obviously a big problem and growing. Our mental health crises, which in many cases includes some form of an addiction problem.
Thank you. Dave, I wonder if we want to start taking questions from folks either about the Anchor Economy dashboard or for Jackie and Chuck on Anchor institution engagement in communities and the impact that can have.
Let me unmute and we'll get to some of the questions. One technical question was raised when you refer to the Reading metro area. That is referring really to Berks County, not just the city of Reading.
That's correct. That's correct. The geography for when we say Reading is Berks County. Yep.
Do you have examples, Deborah, of communities where there have been really good at sort of maximizing the relationships between anchor institutions and the communities that they're serving to create that value for them, that collective impact?
Yeah, and there are really a few great organizations that are helping communities focus on this work. So, I think this, when you sort of track the kind of anchor discourse or movement, you really see it moving from anchor institutions realizing that their relationship to the communities they're in is symbiotic, right? So goes, as the community goes, so goes the institution. And that led to a lot of community engagement work by individual institutions. I think that a lot of that kind of emerged in the 80s and 90s. And then starting in the 2000s, you see this movement towards anchor collaboratives. So Chicago created an anchor collaborative called CASE. In Philadelphia, it was the Philadelphia Anchors for Growth and Equity. And you see these groups grow up, and they, I think to Jackie's point, I think what they often do is they identify a specific thing that is in their wheelhouse, right, related to their strengths that they could accomplish together that they couldn't do separately. And often these are focused on a specific issue. So in Philadelphia's case, it was local procurement. It was like, okay, we all have this really significant spend on goods and services. Let's take a look collectively at what is sticking to the region and what's bleeding out. And let's see if we can harness more of it, one, for the region, and two, who are we supporting? Is this equitably distributed? If we have minority-owned firms that are locked out from contracting with the universities, how can we identify that as a challenge and address it? And so, one example is through that collective look at local spend, a university recognized that its window washing contract was not accessible to a smaller minority-owned business that was in that space because the equipment that you needed to do large buildings like skyscrapers, which this institution had, the smaller company didn't have that equipment. It was very expensive. And to get the contract, you needed that equipment. And so what the university did was said, there's no reason why we can't have two contracts. We can have one contract for window washing for skyscrapers and one contract for window washing for other kinds of buildings. And then in changing that contract, then they were able to include a new local minority-owned business in their revenue stream. And so I think that those collective approaches, asking a big question about spend, similar collaboratives have done this on hiring, like our institutions are located in these zip codes. Who in these zip codes is working at our institutions and in what roles? Are they sort of evenly distributed throughout the pay scale at our institution? And if not, how can we address that? So I think that's just a couple of examples of how these collaboratives take a choice of where their strengths are, and as Jackie said, where's the need, and then lining them up in a collective way.
Okay. One of the things that when we were forming the Berks Alliance, we spent a lot of time looking at Drexel, and they've done some very significant work in terms of workforce development in the community, not necessarily for Drexel, but for the community at large. dealing with stuff like early childhood education and how to provide that as a way of getting people to be engaged in the community. Are there good examples that you know of that you've been able to see as you've done this work across the country of things like that, where they've used their resources or talents to help deal with workforce issues that may or may not directly affect them?
Yeah. You know, an example from St. Louis, St. Louis has identified 22 zip codes that are either where their anchor institutions are either located or adjacent to. And these are 22 zip codes that have, high rates of unemployment, higher than average rates of unemployment, probably higher than average rates of sort of lower college attainment, lower post-secondary attainment. And their effort there is, the institutions have a lot of jobs, they have a lot of open positions. These are zip codes that are under-resourced when it comes to job opportunity. And so they're trying to figure out sort of like, what is the opportunity to match the jobs that we need to fill and the skills and people that exist in these communities, and what kind of education and training we need to provide. And I think one element that they're adding to that initiative, the St. Louis Anchor Network is what it's called, is some qualitative research. So, not just looking at the numbers around employment and educational attainment in the 22 zip codes that they're focused on, but having real conversations with folks in those communities to understand, do you know what jobs exist? I think, Chuck made this point that, a hospital is a city, a hospital needs engineers, a hospital needs accountants, a hospital needs, tech folks. And so, trying to see if part of the opportunity that exists in looking at those specific zip codes is helping members of those communities understand what jobs there are at these institutions and understanding what barriers there are for those folks to pursue either applying for jobs or training themselves to prepare for those jobs. So just one example of probably many.
Yeah, good.
One thing, David, I will add, I think that's important for Reading, and I'm sure many anchors is, one of the things that we need to do is push our staff to go higher. So when we talk about, people coming in as entry level, right? And whatever that is, right? And that could be just out of high school, just out of college, not even still in high school, we take kids, how do we help support people through the educational process and knowing that everyone has potential and some jobs are not terminal jobs. So if you come in dietary, you don't have to stay in dietary. We will support you through a scholarship, and the scholarship could be to Albright. It doesn't have to be to Reading, but we will pay for you to get a skill, whatever skill it is, as long as it can be used at the hospital, which there's no skills that would go wasted at a hospital. And so many people take advantage of that tuition reimbursement, and many of our pay practices encourage people to go on for education because they actually advance the ladder. And so I think one of the things of the Anchor Institution is also to really encourage people to, career development.
Right. No, that's good. I mean, go ahead, Jackie.
Yeah. Yeah, I was gonna add to that because what Chuck says is really, really important. And it's not just career development, it's educational attainment more broadly defined, because the single most important factor driving urban economic success, as said by Brookings and a number of researchers, is educational attainment. It explains roughly 60% of the variation in the per capita income among large U.S. metropolitan areas. So the idea that Reading Hospital gives scholarships that help people to move their career and achieve higher educational goals is, I think, really, really important for the success of our city and our area.
Good. Yeah, I think one model that we've looked at is a program at Drexel called the Cradle to Career program, where they start with and helping support families with early childhood education and kids at that age, all the way up to getting people careers at the end of it. Deborah.
Dave, I wanted to make a comment on Deborah's comment about diversity and how we expand our reach, how we lift up organizations. But I just wanted to use a quick example. We know that we don't have a workforce here at the Reading Hospital that reflects the communities that we serve. So we're working pretty conscientiously on how do we change that dynamic. And we've uncovered a lot of hurdles, obstacles that we can share with people about how do we get rid of obstacles that are hurting us from attracting young people who are graduating from high school, or families that have come to the area, may not have knowledge, may not have certain basic skills, or where language barriers may be keeping them from being able to participate. And I just share really quick, we had an opportunity, and I say this because of how important connections are. I was at a United Way event. They were highlighting that they've got their seniors, the Reading High School has their seniors now tutoring their second graders, because the United Way has escalated that if you can't read by second grade, you are probably going to fall out of. And to Jackie's point about educational attainment, these are really critical matters that lots of groups are addressing. I just happened to see a young man on a video. I leaned over to my head of HR and said, I want to hire that kid. He's 17 years old, a senior in high school. It was so clear. And what we learned is there's lots of obstacles to this poor young man getting that education that he so desperately wants. And we're working with him. But when I say this is one-on-one combat, it truly is that you've got to get the institutions to understand that it's one at a time to get to the big numbers. But once you get it started and people start to make those connections. So we've now worked with Reading Area Community College to assist a young man to get a chemistry class that he didn't have, because amazing to me, he wanted to be a nurse. This is a 17-year-old immigrant, came here when he was 8, taught himself how to speak English, has gotten through the school district and did not have any idea how to pursue his dream. And I think it's important to just say how important that we connect and pay attention to what's going on in the community, and think of ideas that could I make a difference in that particular situation. And it's teaching us ways that we can invite people into our school, get them prep courses to get them prepared to come in, and give them jobs. So this young man will begin working with us part-time in order to enable him to complete his education. But we really do need to start thinking outside the box. And connecting where we might not think connections exist. I'm not sure I would have connected that the early reading program and the tutors and their ability to finish their education would be a part of what Reading Hospital would get involved in, but they jumped in with both feet. So
no, that's a good point.
Now how to do it again.
That's a good point. I think that of looking for partners, looking for collaborators is really significant. When I was at Alvernia, one of the programs we set up was a Reading Collegiate Scholars Program, where we worked in the high school trying to empower those kids in the high school. Chuck, you were a mentor to one of our students in that. Deborah, I want to ask a question. A lot of what you're focused on is economic development, but do you have any ways of evaluating the impact on community development and making a healthier, more vibrant, more engaged, more inclusive community? How anchor institutions can do that?
Yeah, I think one of the things that we're interested in exploring, and we'll be working on additional research around, is what's the relationship between high reliance on anchor institutions and other demographic and sort of community factors, right? So if you're in a high reliance place on eds and meds, but you have low college attainment, like what's that about and what's going on there? Or you're in a high reliance region, heavily dependent on hospitals and healthcare, yet you have sort of not optimal outcomes, healthcare outcomes for for your population, what's the disconnect there? Or maybe it's the converse, right? That we see that high reliance places do particularly well on some public health measures and some college attainment measures. And so that's data that now that we have the dashboard and we have the impacts and we have this way of measuring the concentration and the reliance, now we're adding on this lens of additional cultural, demographic and economic factors in regions to see, when is reliance a strength? And maybe when is high reliance a vulnerability? Maybe regions that need to diversify their regional economy, they're so dependent on IDs and meds that they're vulnerable to disruptions in those sectors. So that's research that's actually starting now and will get developed in the future. I should also say, I think, one thing that we're hoping is that by setting this sort of benchmark of anchor impact for communities across the country, that catalyzes a conversation. There are, and certainly I've heard this, that, regional economic development planners seeing these numbers saying, okay, well, clearly our anchors have to be at the table now, right? Like, maybe we were trying to persuade them to be, maybe they were in episodic ways, but these impacts are so significant and now we have some numbers associated with them. This is an opportunity to bring the anchors in to set a table, it sounds like Reading already has, around what they can do collectively. So our hope is that a lot of communities use this as a catalyst for that kind of activity.
Great.
Deborah, I think the other piece, or Dave, and I'm just reminded because one of our really key partners happens to be on this phone, is the business community that joins us and partners and really helps us to execute. And I know he knows who he is, so thank you. You have helped us to educate young people over the last decade, one-on-one, and knowing that it takes that kind of work to make a difference. So I want to just point out, those business partners, we're a very philanthropic community. We are so gifted that our community is so generous and willing to help, but we need to think about that as well. How do we invite our corporate partners to be a part of that?
Yeah, I'm going to call on John when we get done here, because that is really the heart and soul of what the Berks Alliance was all about. But one other question, Deborah. There's been some mention of housing. Jackie talked about what Albright's doing with some of their housing. I know in other communities, there have been anchor institutions that have used their resources to help people buy houses or to help them improve their homes. Are there good examples of that where that's worked effectively? Reading has a fairly low percentage of homeowners. It has a high poverty rate. So trying to help people with housing and quality housing is a significant issue.
Yeah, I mean, so I'm familiar with a few programs in this vein. So, I think a lot of this work started with anchor institutions that were located in underinvested in areas with the desire for the anchors to support their own faculty and staff living in the communities of the anchor institutions. So this happened in Hartford, Connecticut, in New Haven, in West Philadelphia, and Philadelphia, where the institutions created incentives for staff to purchase homes. Either they would provide sort of a no interest mortgage for a certain amount of money, or even some seed money for home purchase. So those initiatives have been going on for decades. I think what a lot of communities found, especially anchor institutions that were located in cities, is that as cities improved, what they were coming up against, and this is a more common conversation that I'm hearing now, is housing costs are going up. And a lot of the communities around the anchor institutions, as the anchors have done economic and community engagement, have gentrified. And so longtime residents are kind of priced out. And so now there are sort of housing crunches and housing shortages. There's a consortium in Washington, D.C., where housing prices are very expensive. A consortium of universities that have developed a sort of a housing building strategy. And I have the report, which I'm happy to share afterwards, where they sort of diagnosed what the housing shortage was, how the universities could start to collaborate on building affordable housing in the Washington, D.C. area. And so I think what you're seeing is this evolution of institutions trying to encourage faculty and staff to purchase locally and subsidizing those through those kinds of housing subsidy programs, to now taking a look at this issue of housing affordability. And as Jackie said, we've heard of other communities where moving more students onto campus and campus housing, which frees up some off-campus housing if you can sort of upgrade it. And so I'm happy to share that Washington study after this.
Oh, that'd be great. I'm going to do 2 quick commercials for organizations here in Berks County that I think are helpful for organizations potentially here in Berks County that could be helpful for this. One is an organization called the Berks Latino Workforce Development Corporation, or Tech Centro Berks. And we're going to be doing a spotlight program on them. They're really focused on how do they engage and work with the Latino community in Berks County in particular to do things like provide them with the support services, the education services, and those kinds of things. They can be a very good partner in terms of dealing with this. We're going to do, as I mentioned, a spotlight on them next month. And another one that we did a spotlight on is a group called Jumpstart Germantown, which is trying to come here to Reading, which works with trying to train people to do the sorts of things that some of us, some conversations about how do you upgrade housing? How do you do development work, redevelopment work? How do you help those people who want to wash the windows in the tall buildings? So 2 organizations that we're familiar with through the Berks Alliance that are good potential partners for all of the anchor institutions here in Berks County. And with that, I'm going to turn it over to John for some quick final comments. We have to do a commercial for the Berks Alliance.
Of course, thanks, Dave. And Dave, thanks for moderating this session. I want to apologize to everybody. I had to step away for a little bit to deal with an issue, so I missed kind of the middle of the presentation. But I can't thank enough our presenters. And Deborah said something that was really key to me that stuck in my head, which was we got to get our anchor institutions to the table. So that's really what the Berks Alliance is all about. So I'm hoping that not only the anchor institutions that are on this call, but some of the other key ones in our community, that we can literally come to the table and talk about some of these challenges and issues. And one of the things that I'd like to do, if everybody will cooperate with Dave and myself, is I'd like to reach out to our anchor institutions to understand the employment situation that they have and the kinds and nature of positions that they're trying to fill, so that maybe the Berks Alliance can provide some kind of a clearinghouse function to work with organizations like Tech Centro, Berks Latino Workforce Development Corp, where I'm on the board, to try to get some kind of a registry of what are the high turnover or really the hard to fill positions that we could, through collaboration with a variety of organizations in our community, put together pipelines to fill routinely those kinds of positions. And I think Sue really put her finger on something that is a challenge, and that is sometimes we have to solve these problems one person at a time, and that it's not that, just a blanket solution is, one size fits all, I don't think is going to work for us. And that's really been historically the strength of Tech Centro, is we have exceedingly strong case management so that we can help our students organize their life in a way so that they can complete coursework and then find a position in the community. So again, I think the start is that Dave and I will work to understand the employment situation in the community, then we'll work to bring some of our, as many as possible of our anchor institutions to the table to talk about some of these things and what the specific barriers are that we need to help folks through. And education is one of them, transportation is one of them, childcare is one of them, language barriers is one of them, skill set deficiencies are among them. Dave mentioned housing. That's one of my big concerns, is that we just don't have enough quality housing for families in our community, and we really have a big deficit. And of course, through the pandemic, and now with all the inflation, housing has gotten just so darn expensive for people, and we have to figure out a way to solve for that as well. So a lot of moving parts here, but the main message is that this is not an insolvable problem in my view. And really the key to it is collaboration, is working together to put in place reasonable solutions that the community can support and we can afford, and that we can, collectively make work. So Dave, that was probably more than you wanted me to say, but again,
No,
I just want to thank everybody for your participation, both the participants and the presenters. This is really a key conversation, and my hope is that today's just the start of the conversation and not really the end. So Dave, I'll turn it back to you.
Yeah, thank you, John. I think those are well taken points. That's part of why we wanted to do this, is to have this very broad conversation. Deborah, I want to thank you for the work you're doing, but also for this presentation today. It was really good. Sue and Chuck and Jackie, thank you for not just participating in the conversation, but all the work that you're doing in the community to make it a better, healthier, more vibrant place. That's well appreciated. I want to thank our audience for coming and enduring with us as we went through this. I think it was a great program. It's such a great and important topic. The role anchor institutions can play in changing in communities is just really significant. And we will get you all a copy of the video and the PowerPoint presentation, and collect some of the comments and questions and send them to out with people as well. Because I know, Deborah, you gave us a link to an important website to follow through. I don't know if you have any last thoughts, Deborah, so we'll let you go last.
Well, I appreciate the last word, and really all I want to say is thanks. It's really an opportunity to make people aware of a new resource in the dashboard, and honestly in me. So, happy to share my email with folks if they want to follow up in any specific ways about what we're doing next and what we're learning at the Anchor Economy Initiative. So thanks, and thanks to Jackie and Chuck for participating in the conversation afterwards. That's what really matters.
So thank you, everybody, and we'll see you at some of our spotlight programs coming up, and we hope to have a community forum sometime in June. We haven't got the topic entirely settled down yet. But thank you, everybody. Have a good rest of your day.
Thank you, Dave.
Thanks,